It's almost 5 months since Africa had its first COVID-19 case, and there's still huge uncertainty as to the true path of the disease. Right now, the figures on deaths and confirmed cases are low. There's been a total number of deaths in Africa around about 11,000. That's for the whole continent. Put that in perspective, that's 1/4 of the number of deaths in the UK alone. But the question is, to what is this attributable? It could be that Africa has a more resilient and immune population. It could be the youth of the population plays a part. Or it could be that Africa is not recording all its deaths, is not doing enough testing, and it could be that the worst is yet to come. So we don't know. In this paper, we've used two widely divergent models to try and get a sense of what may happen. One is the WHO Africa modelling exercise that predicted for the whole of the continent of Africa some 87,000 deaths through COVID. The other is modelling done with the London School of Hygiene and Tropical Medicine, whose figures are much, much higher and run into over 1 million deaths. What we do in this exercise in this paper is try and look at what is the right combination of social distancing and shielding to give Africa the best chance of limiting the number of deaths. And we've come up with a formula that's roughly 20% social distancing, 80% shielding. In other words, in social distancing, there's a limit to what Africa can do. But it can do things like providing masks where it's appropriate and controlling large gatherings where the disease can spread easily. It's in respect of shielding the most vulnerable people that we think Africa has to put the most emphasis, because we know those people who are most vulnerable. They are those who are elderly and those with other conditions. What we propose are a series of very simple and basic measures. Things like making sure that the frontline healthcare workers are properly protected because they're especially vulnerable. Mobilizing the community to identify at a local level those that are vulnerable and what can be done to protect them. Establishing the right data on what is happening within the country. And of course, making sure that there's testing in order that we see the prevalence of the disease in the country and in local communities. So where we are right now is we can't be certain what will happen, but we've got to hope for the best and plan for a worst case scenario. In this paper, we show why and we show how.